44 people have been confirmed as having the exact same strain of hepatitis C, meaning that all of the cases came from the same source, except that medical investigators say they have no idea what that source was. The North Dakota Department of Health has issued a preliminary report on the outbreak, saying all 44 of the victims had spent time at Manor Care in Minot. But the report says investigators from the state and federal Centers for Disease Control couldn't identify exactly how each patient became infected with the dangerous disease. The 44 cases make the Minot outbreak the second largest on record, behind only an outbreak in Nebraska tied to an oncology center in the small town of Fremont. That infected 99 people. One of the victims in that outbreak wrote a book called A Never Event, a term given to a preventable medical tragedy. That hepatitis C patient, Evelyn McKnight, also started a group called Honor Reform, dedicated to protecting patients against the disease. Steve Langen is the executive director of Honor Reform and says it's not unheard of for outbreaks to go unexplained, but that's not normally the case for such a large outbreak.
We're putting out a call to action to epidemiologists and others throughout the country that we need to do a thorough chain analysis of all of the practices and procedures there at Manor Care, so there can be a determination of what caused this life-threatening disease to these 44 patients.
So what is hepatitis C? It's a virus that's spread by blood contact, and it causes chronic liver disease. It can lead to the need for a liver transplant, and in about 5% of cases is deadly. Since hepatitis C requires blood contact to spread, you can't get it the way you would a cold or a flu virus. It's nearly always contracted through reuse of needles, which is common among illegal drug use, and improper tattoo techniques. But the Minot outbreak involved people in a nursing home setting who were not using illegal drugs or getting tattoos, and whose median age of 84 is much higher than any other hepatitis C outbreak in the nation's history. That's just another piece of this mystery that is the Minot hepatitis C outbreak. And over the next few days, we'll be looking into that mystery. Jim Olson, KX News.
Yeah, it's scary.
It shouldn't have happened.
That's how the daughters of one of the 44 people infected with hepatitis C in the Minot outbreak characterize what's happening. It's scary, and it shouldn't have happened.
The majority of people who have hepatitis C drug use tattoos, and that's not my dad. And so they were embarrassed. They didn't want to tell people. It's still scary. You don't know how it's going to affect his body.
It's scary for Tam Black's father because he doesn't know how the disease will impact him and his family. And for Jan Laudenschlager, it's frustrating that so many people, including her father, are now stricken with a disease that could shorten their lives.
For months afterwards, they didn't even really want to go anywhere, and they're still concerned about it.
The sisters have become medical detectives of a sort, trying to get to the bottom of the situation, even as the state health department and U.S. Centers for Disease Control conducted official investigations.
We'd just like to know how he got it, and the rest of these people, how they were contracted it to.
The problem is the state health department's preliminary report on the outbreak finds no specific cause for the disease that hit 44 people.
It's pretty large, and that's why to not come up with a cause or even the original person who had hepatitis C is very frustrating for us.
Dad was in there for 6 days, and he only had 2 blood draws and a tuberculosis test. And it seems like using Dad as a baseline, they should be able to figure this out, and we'd just like to get everyone back to the table and look at it again.
How can somebody spend 6 days in a nursing home and come out with hepatitis C? It shouldn't happen.
That's Dr. Kashmir Nwigwe, the head of infectious disease at Trinity Hospital in Minot. He's not happy to hear that the investigation may end without identifying the exact source of the outbreak.
I think that would be a travesty, particularly to the people who have contracted this infection and their families.
I don't think these people should be forgotten. I think they deserve to know why they got it.
Tomorrow, we'll hear from the state health department and the Centers for Disease Control about how the outbreak has been investigated. Jim Olson, KX News. When Trinity Hospital's Director of Infectious Disease saw the first 2 cases of hepatitis C in patients in July, he was confused, and he remains flummoxed to this day.
There are certain things that are unique A little bit unique about this outbreak that still puzzles me.
Dr. Kashmir Nwigwe had identified hepatitis C in 2 patients who were not in the risk group for contracting the disease, the elderly. So he notified the state health department.
Testing revealed that there were actually more people than we had originally suspected.
By the time the last patient had been diagnosed with the strain identified in this outbreak, it was October, and 44 cases now made up the most unusual group of hepatitis C victims ever. The median age, 84, much older than the group normally considered at risk, those who'd used needles for injecting illegal drugs or receiving unsanitary tattoos. The investigation found all of the infections happened at Manor Care in Minot, but the medical sleuths were unable to unravel key questions. How did the disease get into the victims' bloodstreams? And who was the first to contract this exact strain of the disease? That's another one of the mysteries in this case. It's the largest hepatitis C outbreak ever to go unsolved in the country. Not that there have been that many major outbreaks of this disease. Only 8 times since 1998 had there been more than 10 people infected in a hepatitis C outbreak. This list from the Centers for Disease Control and Annals of Internal Medicine shows that of the 8 outbreaks since 1998, 7 have been solved. Only one, the Minot outbreak in 2013, is still a mystery. Another thing to note in this list, 2 of the most recent major outbreaks were crimes. They were attributed to drug diversion, where a medical worker intercepts a syringe carrying a drug he wants to use for his own purposes, injects himself with the drug, refills the syringe with something else, maybe saline, and injects that into the patient. 43 people were infected in that way in a most recent case. The perpetrator's been sentenced to prison. Drug diversion is something the head of Honor Reform, a nonprofit group set up by one of the victims of the largest ever outbreak in Nebraska in 2002, says needs to be considered in any major outbreak.
Yeah, we need to be very cautious. We think diversion is something that's running rampant throughout the United States, and we're doing all we can at Honor Reform and among our many colleagues and partners to try to prevent diversion.
It's a very big mystery.
That's how the viral program coordinator at the state health department describes the hepatitis C outbreak at Minot's Manor Care last year. 44 people were diagnosed with the dangerous virus that spreads through blood contact. But it started much smaller, with 2 or 3 patients initially reported to the department by Minot Dr. Kashmir Nwigwe. Sarah Weniger of the state health department began an investigation.
But as our case number rose and we had to review more charts, we did need assistance, and that's when CDC came on board.
Investigators looked into medical records and did extensive interviews with patients who had contracted the disease. All 44 were current or former residents at Manor Care. Part of the probe involved looking into staff members who were on duty when residents had procedures that could have transmitted the virus to their bloodstreams. Those staff members were tested to see if they were infected.
We did test employees. We tested about 100, and there were no positive employees or no employees that became cases as part of this investigation.
But staff testing is not a perfect system, especially in this outbreak, because of the unusually long period of time over which people had become infected. Here's what they found. The first reports of hepatitis C came in mid-2013. After that, the health department and CDC began testing residents of Manor Care. What they found was a bit of a shock. Some residents had positive hepatitis C tests dating back to 2011. But it wasn't until the report of the outbreak that it was discovered that the genetic signature of those cases was identical to the newly discovered cases in mid-2013. That meant many staff members had long since left employment at Manor Care.
It didn't seem like a likely source, since there were very few commonalities between each one of those patients that we were interested in.
Still, the investigation needed to cover a very important topic: drug diversion. Many outbreaks in recent years had been because a health worker injected himself with a drug designed for a patient and then used the same needle to inject the patient with saline. In those outbreaks, they spread hepatitis C to several patients. So could something like that have been going on at Manor Care?
Because that's typically what Hep C outbreaks are related to, and that is not what we found. We did not find indication that that was what was happening in Minot.
In the end, the health department's preliminary report on the outbreak had to admit a sobering fact.
The exact transmission's unknown.
And likely to stay unknown.
And likely to stay unknown.
We don't know who has the authority to reopen the investigation, because as we understand right now, it's closed. The state investigation is closed. So we need to figure out who has the authority to reopen it and take another look at it.
Tomorrow, we'll talk more with Tam Black and her sister, daughters of one of the Minot hepatitis C victims, and with a local infectious disease doctor about the medical implications of the disease in the elderly. Jim Olson, KX News.
It should not happen. Even if you identify one, that is too much.
The head of Trinity Hospital's infectious disease department says an elderly person who has taken no risks associated with contracting hepatitis C should not have to deal with the dangerous disease. Dr. Kashmir Nwigwe says that the fact that 44 people and their families have to confront the effects of the virus is a travesty. But it is a fact, and the coordinator of the viral program at the State Health Department agrees that the size of this outbreak is hard to believe.
It is a large number for this type of an outbreak. It's huge.
Sarah Weniger helped to investigate the outbreak along with the Health Department and Centers for Disease Control. She says the bottom line is that this outbreak cannot be attributed to a simple accident.
You know, one or two accident, but when you have 44, or, you know, when we did testing and one facility has such a high prevalence, that's not an accident.
No matter how you do the statistics, it is impossible for it to be an accident.
The cases were found beginning in July of last year, and by the time the last hepatitis C victim was identified in October, 44 people had been found to have contracted the disease. The investigation could not pinpoint a method of transmission, and yet the cases stopped coming in as of October. Why? Well, that's another question with no real answer.
Something happened, and it may, since these cases had been occurring over time, it may have been something that had been happening over time. And then once we got notified, we investigated, and now it's not happening anymore. We just don't really know what that was.
Just another mystery in the largest unsolved hepatitis C outbreak in the nation's history. Jim Olson, KX News. Jan Laudenschlager's and Tam Black's father was recovering from a stroke in late 2012, spent 6 days at Minot's Manor Care for rehabilitation. It was a good experience.
They do have an excellent rehab program over there. We're very happy with their program.
I sat in on some of the physical therapy, and we were very pleased.
But over the next several months, their father was struggling with symptoms related to elevated liver enzyme levels and ultimately had a blood test that showed that he had contracted hepatitis C.
So then things changed.
Their father's case became one of the first confirmed cases in the Minot hepatitis C outbreak, an outbreak that ended up hitting 44 people with a median age of 84. But hepatitis C has always been considered a disease that impacts younger people, people with a history of IV drug use. Among those patients, the disease can take many years to show itself.
We know that if for young people, when they get infected, it takes anywhere from 10 to 20 years or longer before they start manifesting symptoms and progressing to liver cirrhosis and liver failure.
Dr. Kashmir Nwigwe is in charge of infectious disease at Trinity Hospital and says there's very little known about how hepatitis C will affect elderly patients who had just contracted the virus.
From what we've seen in this outbreak, we've seen a few cases of people who were affected in this outbreak, which we anticipate is probably maybe 2 years or 3 years at the maximum back, manifesting with evidence of severe liver damage. So we think that elderly people, if they get infected, that the disease will progress faster than it would progress in younger population.
It's that uncertainty that has people like Jan and Tam worried about their father and about all the other people infected too.
Yeah, it's been like they've just kind of forgotten, and you don't want them to be forgotten.
They're trying to get their father a drug that could help him deal with the hepatitis C infection, but so far, the Veterans Administration has refused to approve it for his treatment. Jim Olson, KX News. When Jan Laudenschlager's and Tam Black's father was diagnosed with hepatitis C last July, some questions were answered. They now knew what was causing his health problems that had seemed a mystery. Of course, it also raised many other questions, the biggest being, how could a man in his 80s with no risk factors for contracting the blood-borne virus spend 6 days at a rehab center and nursing home and end up with hepatitis C?
Dad was in there for 6 days, and he only had 2 blood draws and a tuberculosis test. And it seems like using data as a baseline, they should be able to figure this out.
How can somebody spend 6 days in a nursing home and come out with hepatitis C? It shouldn't happen.
Of course, it did happen to nearly 4 dozen people who spent time at Manor Care in Minot, and it's been difficult for the father and mother of these women.
For months afterwards, they didn't even really want to go anywhere, and they're still concerned about it.
That continuing concern is why Jan and Tam are hoping to reach out to other families who are going through this ordeal too.
You know, it would be nice to know some of the other victims and maybe talk with them and see what they're doing or work together, because it's nothing to be embarrassed about, and maybe if everyone joins together we can do something or come up with another solution.
Toward that end, a meeting has been scheduled for next Wednesday where friends and family members of those who contracted the disease can meet each other, talk about their common battles, and learn from the director of infectious disease at Trinity Hospital.
There are certain what they call never events, things that should not happen. It's not, even if it is one, that is too much.
A Never Event. That's the title of a book written by one of the 99 victims of the largest ever hepatitis C outbreak in the nation. Evelyn McKnight also started a group called HonorReform.org, dedicated to making healthcare safer from future hepatitis C cases. HonorReform.org's director says forming a support group among victims and families is a great idea.
We need to band together in order to ask in a thorough and ongoing way for answers to these serious questions we have about how this outbreak occurred and why there are currently no answers.
And that's the bottom line for the people mired in the mess of this outbreak.
We'd just like to know how he got it.
Getting to the bottom of the largest unsolved outbreak of hepatitis C in the nation's history. Jim Olson, KX News.